actually choose can oftentimes come down to what are your potential side effects going to be.
Right. And Dr. Schaffner, in a similar fashion, what services would you possibly offer to men prior to their treatment if they were to come in and see you pre-treatment?
That's a great question. I often will speak it to your physicians, or when we're out, and our marketing staff will come out and let the doctors and let the community know that the pre-treatment, it is much easier to learn how to use a muscle before it's been traumatized. And so when you come, and surgery is traumatizing, it's calculated, right? So you're going in, you're doing a surgical procedure. Oftentimes there may be catheters involved, which makes the pelvic floor not have to work as hard. And so if we think, and we put this in the light of, let's say, just a regular muscle surgery, like a knee surgery, we use our legs all day long and we know how our thighs and our quads work, but the pelvic floor, we're not quite sure. People are not quite aware how that pelvic floor works, what part of it's voluntary, what part of it's not, what can we control, what can we not. Some of the habits that patients have beforehand relative to even how much water they drink in a day, that is a huge issue that I see coming in with patients after surgery. Is they have incontinence, therefore they think it's okay to not drink water, which leads to a host of other problems, including dehydration, more joint pain, fall risk, and a lot of other things that can cause complications. So we can educate and counsel on those behavioral changes that need to occur, whether they have surgery or not, but also how do they use their pelvic floor? How do they get it working? How do they know where it's at? How does the whole system function to help them have a better quality of life before they have radiation or before they have surgery or something that makes it so that maybe they can't feel as well, or, how to know how to turn that muscle on and off.
I can't tell you how many times I've turned to a patient and said, we're going to have to teach you some pelvic floor exercises. And they look at me and they go, I can't get down on the floor. And I go, no, that's not exactly what I mean.
Right.
So it really does take a lot of explanation for people to understand that there is something. There is a part of your body that you quiescently need to take care of. And it's not like moving your biceps and lifting weights. It's something you have to actually learn how to target it. And that's where your services come in very, very handy and essential.
And incontinence is not a normal part of aging. It's been something that men and women have had to deal with quite frequently, because of not whether you bear children or not, but it's been a very taboo conversation. And so people still don't want to talk about it. And it doesn't have to be a normal part of aging. It is something that we can definitely control, and have some measure of control over as we do age or through whatever life process takes us.
Right. And you don't need to be relegated to diapers.
No.
And that's why we're here tonight, to have that
Or your
conversation.
home, or your home. Some people refuse to leave their home because of it.